We're outside of the CBU College of Nursing, a competitive program at CBU that prepares nurses to serve others as Jesus would. Within the program, nurses work in simulation labs with human-like mannequins. We wanted to find out more about these mannequins within these labs. Let's take a look.
So we have so many different kinds of mannequins here. We have mannequins from Laerdal, we have mannequins from Gamard, we even have what we call hybrid task trainer mannequins from a company called Avkin. And the mannequins, they range from low fidelity, meaning they are not as realistic in terms of, some of them have full computers inside of them, so they even put out CO2 just like a normal human would. You can do all sorts of procedures on them. They give, real-time responses. We have a mannequin that gives birth, so those are more high fidelity. Our low fidelity is more for skills and things like NG tubes or putting in Foleys or sometimes doing IVs. We have the Avkin products, which are wearable. They're very high fidelity, but things like they can basically put on this chest and it simulates a trach, and then they can suction and it gives the actor feedback so they can respond, but it really feels very realistic, like they're actually suctioning a real human being. So we've got a wide range.
Wow. How late or when in the program can nurses start using?
Right away, day one. So they do something called Open Skills Lab where they're working with a lot of these mannequins. They're doing simulation in their very first semester. Every single semester has a clinical component, and so anytime they're doing clinicals, they're also coming back to do a simulation activity. But in Open Skills Lab, they can use any of the resources that we have in the building to get them through the program in a successful way so that they can be patient ready. So they're able to care for patients right away when they graduate. So our simulation program is a fully accredited simulation program, so students get to come and they get to be in an environment that simulates whatever clinical environment that they're going to be going into. So for example, if they're going into med-surg, it's going to simulate what that's going to look like, a hospital type setting. If it's community health, they're going to go into an apartment that we build in this room right here, and they are going to interact with actors, mannequins in that more hybrid simulation, and it allows them to make mistakes here and not with real patients, and then they get feedback on those mistakes. They get to ask questions, they get to reflect, they get to watch their own video, and then they get to try again before they actually go out and work with patients a lot of time in those specific settings. So it's a really wonderful way to learn, and we, as I said, are fully accredited, and so we do it very well.
It was great hearing from Dr. Pierce about what CBU Nursing offers within their simulation labs. With CBU TV, I'm Amber French.